So the procedure for getting a dental implant first involves a consultation, during which time we would determine whether or not a patient is a candidate for a dental implant. Part of that consultation involves taking a CAT scan, which shows us the patient's jaw in 3 dimensions. At that point, I have determined that the patient is a candidate because they have adequate bone to place the implant. Once that determination is made, then a consultation happens between myself and the restorative dentist in order to decide how many implants the patient needs and what is the proper positioning of the implants. The determination of where to place the implant is guided by the restorative dentist. And it's very important to have a proper team in place so that the implant is placed in the correct location so that it can hold the patient's tooth later properly for the rest of their lives. A lot of work that I do before I even do surgery on the patient is done beforehand in the background. After I've taken the CAT scan, I will spend time doing their virtual surgery on a computer model, which allows me to place the implant into the proper position based on their CAT scan and their jawbone. This avoids any type of mishaps where certain structures, nerves, or arteries may be hit if a 3D CAT scan is not available. So that at the time that I do my surgery on the actual patient, I have already done it at least once virtually, so I know what I'm getting into. There's no winging it at any part of the procedure, and the patient gets the best result that way because I have all the information that I need before going into the surgery. Placing 800 to 900 implants a year gives me the opportunity to develop a procedure and process which is predictable. And the key is when you're picking your surgeon, you want to go to someone who's first of all properly trained as an oral maxillofacial surgeon, and subsequently someone who does this every day so that they have a technique in mind where they can avoid any type of mishaps. The procedure itself involves usually a light sedation. It takes between 30 and 40 minutes for most cases. A single tooth can take as little as 15 minutes. After the patient is anesthetized, local anesthesia is administered into the area, and then the gum is opened next to the area where we're placing the implant, and a small opening in the jawbone is done in order to place an implant. I'm going to use this model to demonstrate the surgery. So if a patient comes in and they are missing a tooth, the first portion is to remove the gum or open the gum next to the tooth, and then an implant is placed, which is a titanium structure which resembles the root of a tooth, into their jawbone. After this is done, then their gum is replaced over the area, and then the patient would leave with this area where the implant was placed suture closed. Most of the time they are not seeing their implant. Once the patient leaves, they would go home on some medications. One would include a pain medication in case they needed, an antibiotic to prevent any infection, and a special rinse. I would see the patient in 2 weeks to check on the implant to make sure that it is healing properly. And then the patient is seen between 6 weeks to 3 months later to do the final evaluation of the implant. That final evaluation requires a small x-ray to check how the bone grew around the implant and checking the stability of the implant in the patient's mouth. Once that's completed, the patient returns to their dentist, who would then fabricate a custom-made tooth. Once the tooth is on the implant, the patient feels as though their old tooth is back. This is a permanent implant which does not get removed. The patient doesn't have to worry about taking their dentures out at night, putting them in a glass, their denture getting loose, anything falling out of their mouth. Once this is done, the patient can go out and have a big steak dinner on me and enjoy their new teeth.